The treatment of varicose veins has dramatically changed in the last 10 years. The standard of treatment used to be vein stripping, which required general anesthetic, going to the hospital, and 2 or 3 days in the hospital and 2 or 3 weeks recovery. We have now switched this in the last 10 years with our new modern techniques to just an office procedure done under local anesthesia and going to work the next day. And the big thing is that it's covered by insurance. So all these modern innovations have really drastically changed the way we treat varicose veins, and it's changed it from a hospital-based procedure to an office-based procedure and a patient-friendly procedure. The main reason we do varicose veins is because of the symptoms they cause, and a lot of people are presenting with very symptomatic problems with heaviness in their legs, aching pain, trouble sleeping at night, swelling, itching, and burning in their legs. And all of these symptoms can be dramatically changed just in 1/2 hour of treatment. The treatment of varicose veins is really broken down into 2 segments, and that is first to treat the larger veins, or really the source of the vein problem, and then treat the more cosmetic or superficial veins that the patients usually come in for that they see on their legs. So this is the way we approach it. We first treat the trunk of the tree problem, and then we treat the branches of the tree. The real important part to the patient is taking care of those veins that are actually bulging and that they see. And we have many ways to do that and very effective ways to do that. The larger veins are actually better treated with a simple little procedure called a phlebectomy, and this is done right in the office under local anesthesia. We inject the skin with a little local anesthesia to numb it up, and then we actually make little small incisions and pluck the veins out of the leg. Now, cosmetically, this is a very satisfying procedure for patients with large varicose veins that are right on the surface. There's also another way to handle it when they're smaller, and it's better for the patient. They just get better results with using sclerotherapy. So we treat fairly large veins with sclerotherapy. They're on the surface, and then we treat smaller veins with sclerotherapy. They're on the surface. And now we get down to treating the small little red veins that most everyone has on their legs, and usually is what brings the patient into the office. They're more cosmetic treatments. And these are also done with sclerotherapy. But there are cases where the veins are too small, and what we do is we use laser treatment. So we use the surface laser on the very tiny veins that can't be accessed with needles that allow us to do sclerotherapy. So at DeKalb, we have all of these methodologies available. It's very satisfying to work with the patients and to lead them down the road to recovery and to satisfaction and good cosmetic results.